Hi everyone, I'm Alyssa, and my research presentation and capstone is on telehealth and its accessibility, especially in terms of socioeconomics. So just as an overview, I'm going to be discussing or introducing telehealth and the general facts about it, especially in the last couple of years, given its rise due to the pandemic, the issues and shortcomings of telehealth, how it's applicable to us and our community, and how hospitals and other healthcare providers can address these issues. So, number one, what is telehealth? Just as an introduction to telehealth, I'm going to read out this quote and then I'm going to kind of explain what it means. So, according to the NEJM Catalyst, which is a peer-reviewed paper or online article, telehealth is defined as the delivery and facilitation of health and health-related services, including medical care, provider and patient education, health information services, and self-care via telecommunications and digital communication technologies. Basically, what this means is that telehealth isn't necessarily a service, but rather a system that encompasses a whole array of medical-related communications via technology. Just what to know about telehealth, you may have heard of it, but you might not know exactly what it encompasses. Number one, the services often include consultations, education, and actually wearable devices that medical providers can track from a distance. And I actually read about a specific instance where an individual who needed to have his radiology scans didn't live in an area where healthcare providers were able to do that. So those scans were actually sent to a healthcare provider from another location that was able to do that service for him, and he was able to get the care that he needed as a result of telehealth. Number two, it's not new. According to an article from 2000, it's actually been around since at least the 80s. And considering that date, that just shows how much of a continuity telehealth has in our modern society. However, according to that same article, throughout the 1980s, the levels for utilization for telehealth was actually really low. In the 1990s, several projects were actually launched with the intention of making telehealth more accessible and widely spread in Europe, North America, Australia, and Asia. However, the real rise in telehealth was obviously in the last couple of years due to COVID, where a research article from 2022 found that there was a 766% rise in telemedicine users in the first 3 months of the pandemic alone. However, the same article or research paper states that even as telemedicine as a system skyrocketed, medical care in general across the US showed a really sharp decline. One estimate using claims data from almost 17 million Medicare and commercial insurance patients estimated that total outpatient visits plummeted by 30% of usual volume between January and June of 2020, and that telemedicine only compensated for about 2/3 of this loss. So, what are the potential issues of telemedicine or telehealth that lead to that plummeted use of healthcare, even when telemedicine seems to be this seemingly advanced system that increases accessibility by providing an online format to healthcare? So, there are three main issues when it comes to telehealth that all are generally encompassed under the idea of accessibility, which seems really counterintuitive seeing its entire point. So the first one is internet access. And the second and third ones, which I'm going to really group together for the sake of time, are insurance coverage and regulations. And I'm going to go more in depth in the next slides. So the first one is internet access, which is the really main point that I want to emphasize. So here's another really big quote. I'm going to read it out and then I'm going to kind of explain what it means in terms of healthcare. So, according to a study from 2021, 17.7% of rural residents in the United States lack access to broadband download compared to only 1.2% of urban residents. The discrepancy is even more pronounced for faster speeds, such as 250 megabits, where nearly half of all rural residents do not have a connection available to them. And if you see the next slides, the next two slides, you're going to see the graphs that actually show this discrepancy in real time so you can visualize it. You can see that throughout 2014 to 2019, there's a huge discrepancy between individuals who live in urban and rural settings and their internet access. So this is the first one, which is just a basic bandwidth 25 megabits. And the next slide shows 250 megabits. And you can see just how large this discrepancy is, especially over time. And this doesn't necessarily just constrain to locations such as urban versus rural. This also just generally has to do with socioeconomic factors. For example, there is a fairly well-known correlation between education advancement and socioeconomics. For example, those who have a high school degree or less are less likely to actually use telehealth than those with a college degree or higher, like a bachelor's degree. And this was found by the CDC and articles published by the National Institute of Health, which indicates telehealth inequity on a socioeconomic level and not just in locations. And so the next 2 points I talked about when it comes to accessibility, insurance reimbursements, and regulations also factor into this. So pre-pandemic, this might not seem relevant, but I'm going to explain why it is. According to the National Academy of Sciences in 2012, again, another really big quote, about 90 million people are in managed care systems, yet there isn't much evidence about managed care organizations using telemedicine to control costs. Additionally, Medicare doesn't reimburse very much in the fee-for-service system, and that reimbursement is largely limited to non-metropolitan areas, to certain institutions, and to certain current procedural terminology codes. What this means is that people who might rely on Medicare, which is a government-issued insurance service, might not be able to rely on Medicare for telehealth because of just how unstable it is in terms of reimbursement and actually covering costs. Even though telehealth visits in general cost less than in-person visits, where it's a $70 to about $120 ratio, because of how unstable Medicare was in covering telehealth visits, individuals who might go to telehealth because of its lower costs might still not be able to cover it or pay for it because Medicare was really unstable in terms of actually being able to pay for those visits, making people pay out of pocket for healthcare services that they could have had covered if they came in person, but might not have been able to in terms of being actually traveling the distance to visit their healthcare providers. And the reason that this is relevant is that post-pandemic, current reimbursement rates last only through 2023, according to the Senior Vice President for Public Policy for the American Telemedicine Association. After that, rates could return to lower pre-pandemic levels. So during COVID, there were obviously policies that made telehealth more accessible, considering that was what most people could only attend or use because of the pandemic. But those policies are only lasting up until the end of 2023. After 2024, which is next year in 6 months, or actually less now that it's August, those unreliable rates and unreliable coverage might return or will return for a lot of especially commercial insurance companies and Medicare as well, which means that people who relied on telehealth because of the accessibility it gives in terms of distance might not be able to do that because of the unstable insurance costs, and they might need to actually have to pay out of pocket, which could hurt them financially, especially for those who cannot afford to pay that out of pocket cost. Number 3, why should we care? How does this affect our community, considering that when we are talking about in terms of the community, it seems to really impact us a lot more. And I'm going to specifically focus on the Bay Area. So all of these findings were done by the Bay Area Equity Atlas in 2023. So nearly half of all Bay Area residents who live in families are low income or very low income. Compared to the other Bay Area counties in particular, San Francisco has a markedly higher rate of low income residents. And Black and Latinx residents make up a disproportionate amount of the very low income residents in the 9 counties in the Bay Area. So what does this mean? The Bay Area is generally considered a wealthy area to live in, especially California has this reputation of being very financially stable with the whole technology side of where we live. However, this kind of busts that myth that we have about our community, considering that nearly half of the people who live here, who live in families, are considered low income. As a result, they're going to be especially affected by the telehealth disparities that I discussed earlier in terms of insurance or being able to pay for internet. And this especially also plays into race as well. There is a obvious connection between race and socioeconomic disparities, especially when it comes to Black and Latinx residents and also Native American individuals. They have a higher rate or likelihood of being low income, showing that this telehealth disparity not only impacts individuals on a socioeconomic level, but also on a racial level. So, what can healthcare providers and hospitals do in order to address these disparities? So, there are main plans that can really address these disparities going on: the Connecting Americans to Healthcare program and Biden's Affordable Connectivity program. So, the first one, Connecting Americans to Healthcare, is a program by the Federal Communications Commission during COVID, where the FCC, Federal Communications Commission, established a $200 million COVID-19 telehealth program to help healthcare providers provide connected care services to patients at their homes or mobile locations in response to the pandemic. It also had an increasing service care funding section, as well as supporting telehealth by waiving gift rules, which means that the FCC waived gift rules in rural healthcare communities or programs to make it easier for broadband providers to support telehealth during the pandemic. The waiver also allowed for healthcare providers to accept improved capacity, Wi-Fi hotspots, networking gear, or other equipment or services to support doctors and patients during the pandemic. And this actually also does extend to now, but like I said before, a lot of these programs that were a response to COVID will be shutting down, but the best thing that hospitals and policymakers can do is advocate for this program to continue how it was to its full extent without any program shutdowns. And the second one, which is Biden's Affordable Connectivity Program, the Biden-Harris administration secured commitments from over 20 leading internet providers to provide ACP-eligible households to a high-speed internet plan for only $30 a month. And high-speed internet is really expensive. If you have ever looked at your internet bill, you can see how expensive it is. So this is fantastic for low-income individuals to actually get the broadband that they need to connect with their healthcare providers. However, what's also great about this program is that nonprofits and other organizations can also get grants. So hospitals, especially in rural areas, can utilize this program to expand their telehealth facilities that can help low-income individuals access proper health care. And in terms of My Digital Tattoo, since My Digital Tattoo does connect with healthcare administrators, there is a possibility that this nonprofit could be able to get a grant and help kids in rural areas get access to mental health care via telehealth or healthcare in general, including by education, considering that this nonprofit also does partner with educators. So those are the two main plans that can really help in terms of telehealth disparities and improving accessibility, making telehealth so much better and really improve the way that mental health care or actual healthcare works in America. Thank you.